So PROACT-SCIPr, it stands for a positive range of options to avoid crisis and use therapy, strategies for crisis intervention and prevention. So what this means is it's a whole organisational behavioural support framework designed to improve the quality of life for the people that we are supporting. It works for all individuals, those with autism, learning difficulties, physical disabilities and mental health as well. So PROACT-SCIPr, it's about combining the principles of positive behaviour support with safe, ethical crisis prevention and intervention strategies. It focuses on prevention and early intervention, trying to understand behaviours and why these may be occurring, and teaching the people that we support new coping strategies, teaching them skills, independence and empowerment. The focus is always on being proactive rather than reactive, and trying to improve the quality of life for the people that we are supporting. So generally with traditional models, they focus on trying to stop the behaviour, trying to control the behaviour, and often resort straight to restrictive practices such as physical intervention straight away. PROACT-SCIPr, we try and focus on understanding why is this behaviour occurring. We try and look at more early interventions, trying to understand the individual and getting to know them, working on improving their quality of life, getting to know what's their communication style, giving them independence and focusing on their well-being, using physical interventions only as a last resort. After we've tried all our proactive, active and reactive strategies and they failed, that's when we would use physical interventions. Generally, if people are satisfied, if they've got that good quality of life, they're gonna have less behaviours concerns anyway, because they've got all their needs and their wants met. So they just become, over time, they become unnecessary. So with traditional behavioural support models, staff are more expected to enforce the boundaries, give consequences and punishment, or manage the behaviours as soon as it's already escalated. Whereas with PROACT-SCIPr, we don't use any punishment, we don't use aversive consequences because it just doesn't work for the people we're supporting. We try to encourage our staff to build rapport, recognise that everyone is an individual, and try and look at their early warning signs of distress so that we can have that nice early intervention and always be emphatic and compassionate in the way that we are supporting people. Another way it differs with traditional models, quite often the training is just limited to the frontline staff, so the people that are directly supporting individuals, where with PROACT-SCIPr, we want all people to be trained in the whole approach. Okay. So this includes all of our internal staff. We've now made it mandatory that they have to do either a 2-day course, the Untitled Foundation, or at the minimum a 1-day awareness course, so that everyone understands the values and the ethos of PROACT-SCIPr, and it works from the bottom right up to the top. It's not just frontline staff, we need the whole organisation to know about it so that we all know the values. The people in the office can offer support to the people that are directly working with individuals, and the admin team, the referrals, everyone's got an idea and understanding of PROACT-SCIPr, what it is and why we're using it.
So the core principles behind PROACT-SCIPr approach are grounded in positive behaviour support, human rights and prevention. It's about being person-centred and the philosophy of the whole approach. So the philosophy about the whole approach is the organisation, staff and the people we support all working as one. So these principles guide how an organisation and staff support individuals who may present with behaviours of concern, especially those with learning disabilities, autism or complex needs. So PROACT-SCIPr is about being personal-centred, positive approaches and treating individuals with respect, dignity at all times, as well as teaching staff how to effectively keep people we support and themselves safe during those times of crisis. It's a 2-day course where we dive into about a person's communication, their diagnosis, their needs, behaviours, where they come from, what they mean, so functions of behaviour, looking at report writing, incident reports, risk assessments, health and safety.
So the actual definition of behaviours of concern would be any behaviour that's of the intensity, frequency and duration that it places that individual or others around them, so like the staff or the people in the community, at risk of harm. So does it limit their access to the community? Could it restrict their access to education or their life opportunities? But with PROACT-SCIPr, we know that every behaviour is communication and all behaviour happens for a reason. There is a purpose behind it. So even this concerning behaviour, we know that it's got meaning and it's got purpose. So is it that that person is trying to escape a demand or a task or something that they find too difficult? Are they trying to get attention from those around them? Perhaps they're trying to express pain or communicate that they're frustrated, and at the moment this behaviour concern is the easiest and perhaps the only way that they know how to communicate this frustration. We want to understand what is it that they're trying to communicate, what is their unmet need, and how can we try and proactively meet this for them. So our response is trying to focus on identifying what the behaviour is, why is it happening, what are they trying to communicate, and what is the function behind it, rather than just seeing it as a problem that needs to be solved. We see it as a message that needs to be understood. We try and teach that person. It might be teaching them new skills, such as ways to communicate that they want the item or they want a task or an activity to end. We try to teach them more independence, perhaps being able to go and get that item or do the activity by themselves without as much support from staff. Can we change the environment? Can we make sure that that's set up in a way that's more suitable for them? You know, do they have, if they've got sensory overload, can we make sure we're not taking them to busy, crowded places? Do we know what their triggers are so that we can try and reduce them and avoid them where possible, so that these behaviours of concern are less likely to happen in the first place?
It's a crucial part of our SCIPr framework because we want to reduce persons' restrictions. They want them to have that better quality of life. We want them able to access the community, do activities, tasks that they want to do, not just what we decide for them, what they need to do or they should be doing. So we're looking at them, and it's important about their human rights, because a lot of their human rights are being stripped away for the people that we're supporting. So we want to improve their human rights, looking at their dignity as well, and to support them. Reducing restrictive practices, it's about, like, we want to minimise it because it's traumatising for people we support, isn't it? It can cause a lot of trauma, and we don't know what background the person's come from a lot of the times, what has happened to them in the past. So placing hands on for people with support isn't always the best thing to do. It's going to be traumatising. They'll remember all the bad things that have happened in the past. And it's also about meeting the national guidelines as well from the RN and CQC, and supporting with reducing those practices so people feel empowered and have that better quality of life. Good question. A lot of time, it can be a number of reasons. Sometimes placement's breaking down, sometimes people not understanding the person we're supporting, sometimes they've not realised the severity of what they've done, and there's nowhere else for them to go, so then we can't support them, or people feel like that we can't look after this person and their needs, so then best thing for them is to do is lock them in somewhere secure, or put these restrictions on them, so then they're not going to do that again. When that isn't always necessarily the best thing for that person, because we're placing all these restrictions on that person's life, and then they just look at behaviours as a way to escaping from all these restrictions on that person. Restrictive practices, we know they're there to keep people safe and to keep other people safe. And safety is an essence of part of PROACT-SCIPr as well, but it's about understanding why that person is showing or presenting that behaviour, and making sure that restrictions are right for that person and that behaviour, not just having that blanket restriction of one intervention for everybody. It's about supporting that person, making sure there's the right restrictions and minimising those restrictions for the people we're supporting, looking at it and what can we do to reduce those restrictions. If it's about supporting staff, how many staff have they got supporting, locked doors, windows, or looking at physical interventions as well for the people support, or medication, and how we can reduce those restrictions for that person and improve their quality of life.
Person-centred planning is at the core of PROACT-SCIPr. It's basically person-centred planning, positive behaviour support, that merges together, and that is PROACT-SCIPr. So it's really, really important. We try to encourage co-production wherever we can within PROACT-SCIPr, so it's all about getting the individuals involved in their support. It might be getting them involved in making sure they've got the right staff supporting them, they've got that staff matching, they like the same kind of things, getting them involved in writing their support plans, getting them involved in saying what activities do they want to do, what do they want to fill their days with, getting them involved in decisions about all the important aspects of their life. That old quote, nothing about us without us, Ben. Lovely quote. Love that. So the role of the person-centred planning in PROACT-SCIPr, it's the foundation of understanding that person's behaviour. So as I said before, recognising that all behaviour is communication, and with that person-centred planning, it's helping that staff to understand the functions of the person's behaviour by learning all about them, getting to know their likes, their dislikes, their preferences, their communication styles. Building up that rapport and that therapeutic relationship is really important with person-centred planning and with PROACT-SCIPr, because everyone is an individual. So what one person likes, another person might dislike. And what one person finds really engaging, someone else might find boring. So it's all about knowing that individual and their preferences, what they enjoy and what's important to them in life. And getting them involved as much as possible, getting their support staff involved. It's really important to include the whole circle of support. So that's their important family members, it's anyone that's close to them, the support staff as well, getting them involved in writing the behaviour support plans. It shouldn't just be someone else sat in an office who doesn't know that individual. We always say our staff are the experts. They're the people that are spending the most time with that individual. They know what strategies work for them. And people are forever changing and evolving as well. What strategies may have worked for them a few months ago or perhaps a year or two ago, they're going to grow, they're going to develop, they're going to change. So it's making sure that we're keeping these support plans. They should be up to date, a dynamic piece of work, not just static paperwork that sits in the cupboard for the rest of its life. We want it to constantly be updated by themselves and the people that are supporting them. It's all about the implementation. It's very easy to write these plans, it's about implementing them and making sure that they're actually up to date and they're useful for the people we're supporting.
So we've used PROACT-SCIPr day to day with a person that was supported from York. We started supporting him late last year, where the PBS team and PROACT-SCIPr team got involved in his support, and we transitioned him from secure hospital into the community. This worked extremely well as we dived into his behaviours, we talking to his family members and best how to support. We worked with their manager in UCS Manchester and the rest of their team. We put on a bespoke course where we trained half his staff team in January and half his staff team in February, where it was a 3-day course looking at him, how best to support his behaviours, getting the clinicians heavily involved in lots of activities around his behaviours and how best to support things that he likes, dislikes, and what we can do to support him in those times of crisis. One of our PBS practitioners was heavily involved and he fought very hard looking at reducing the amount of PRN that the person was supporting, as it was a heavy dose of medication, and since then we've been able to reduce the amount of PRN that he is having, which has improved his quality of life. With the restrictions of him going out, before when he was in school hospital he wasn't going out, but now he's been able to go to Old Trafford Stadium, he goes out visit museums with his staff team. He's able to have that good quality of life and go to shops where he wasn't able to do in the past. In last provided as well, there were lots of heavy use of physical interventions, and from this year we've been able to keep count of how many interventions, and that has dramatically reduced as well through the training with PROACT-SCIPr and PBS with him and his staff team.